All right, well, welcome everybody to the information for the 2024 Postgrad Fellow Trainee Year. I'm Melissa Webster, and I'm the director of the Postgrad Training Program, and have been over this program now for 17 years, and have been here in the Department of Psychiatry for 23 years, a little bit, almost 24 years. I actually did my internship in child and adolescent psychiatry, and then did a fellowship. So I was also a fellow many years ago. And ironically, the fellowship actually looked quite different then. And then became the training director and made it my priority to change kind of the fellowship and how it looks, and to increase the numbers. So, for example, when I was a fellow many, many years ago, there was only one in child and one in adult. And essentially, I was paid a very low stipend. I think it was $21,000 at the time, and had a caseload of 32 hours per week. And was essentially doing what a staff was doing at that time, but was just being paid very little. So over the last several years, we've changed the fellowship to be more of an educational program with many opportunities, and obviously have increased the number of folks that are in our program, and and have expanded it to other areas. So today, what I would like to do is go around and have the other fellows introduce themselves. And fellows, just as a reminder, you're going to introduce yourself. Say where your internship was, and then also what area you're currently in and what mentorships you've taken, and if you have a sense of like what you're doing next year, etc. And then also we have Lou here, who is from the Comprehensive Gender Services Program, to represent that program. So Lou, I'll have you introduce yourself as well. And we're hoping to have a CGSP fellow in 2024, but that's still waiting approval. So we don't know for sure, but that is the hope. So Lou, why don't you go first, and then I'll have the fellows go.
Yeah, absolutely. So my name's Lou Evergreen. I use they, them pronouns. I'm the social worker at CGSP, as Melissa was saying. So right now I am working with a MSW intern for our program. And kind of what we do in CGSP, we do a lot of assessments to write gender affirming surgery letters for folks. We do therapy, we do support groups, and then a lot of kind of programmatic duties, building up the program, improving the program, especially as standards of care for transgender health are changing. So yeah, if we get the fellowship for CGSP, there'll be a lot of opportunities to, work one-on-one with folks, work in groups with folks, learn more about the assessment process, and, strengthen and improve the program.
Thank you, Lou. And then I will just call on the fellow so we can go quicker. So Alec, you're first in my square, so go ahead.
Hi everybody, I'm Alec Butterfield, pronouns he, him. I'm a second year postgrad fellow. I'm on the adult side. And I did my internship at the Murray Psychological Clinic, part of the Mary A. Rackham Institute. And the mentorships that I've done include DBT, CBT for depression, for anxiety, and for insomnia, IPT, and MI. I think that's all of them. And then I've been on the crisis support clinic and the PrEP clinic, which is the program for risk evaluation and prevention for early psychosis. And in my second year now, I'm still on the PrEP team, but I switched from the crisis support to the depression team. And I'm also on DBT consult team. So yeah, did I cover everything?
I think so. Thank you,
Okay,
Alan.
that's it. Yeah.
Chelsea.
Hi, I'm Chelsea Benedict. I use she, her pronouns. I gotta scroll up to remember what I'm supposed to say. So I did my internship at the Genesee County Community Mental Health, which is called Genesee Health System. I am on the child adolescent side here in my first year of the fellowship. I've done the child adolescent side of CBT clinic. So that covers OCD, anxiety, and depression. I've also done child parent psychotherapy, which is a trauma-informed dyadic kind of therapy for kids under 5 and under. And I'm currently in the DBT mentorship. Next year in the fellowship, I haven't quite figured out which mentorships I'm going to do, but probably continuing learning more about trauma work, possibly for older ages of children and adolescents. Thank you.
Brooke.
Hello, everyone. My name is Brook Gabriel. My pronouns are she, her, hers. I am a second year post-grad fellow on the adult side. I did my internship here at Michigan Medicine under the supervision of Rachel Fogelberg in the perinatal clinic, and I've remained in the perinatal clinic for both years of my fellowship as well. Since becoming a fellow, I have done the IPT, DBT, CBTI, which is cognitive behavioral therapy for insomnia. What did I do? Really, DBT, and now the child parent psychotherapy mentorships. Oh, and now I'm also completing the family focused therapy mentorship, FFT. So quite a few. Oh, and I wanted to quickly define perinatal. I didn't know what the term meant entirely when I became an intern. So in the perinatal clinic, like peri is about, so anything about issues of birth, reproductive health that intersect with mental health, and that can cover things like postpartum issues like anxiety, depression, psychosis, etc. It can also be prepartum things. It can be mental health challenges and adjustment for non-birthing parents. It can be tied to PMDD, premenstrual dysphoric disorder, and other things like that. So that's what perinatal is. As for where I'm headed next year, that's a good question. I'm still figuring it out. I think I had supervision with Melissa yesterday and said, wow, it really hit me that fellowship's ending. So that's where I am at. Thanks.
Ella.
Hey everyone, my name's Ella. I use she, her pronouns. I was just taking notes so I don't forget anything because I tend to get when I have to introduce myself. I've done the DBT and CBT clinics on the child side, and I am currently in the trauma and grief clinic or mentorship. I'm split my time between the anxiety team on child side and the addiction treatment services intensive outpatient group program. Next year, I'm most likely going to be shifting to working in addiction treatment on the addiction treatment side. I really love group work, and there's lots of group work there. I also just wanted to say, as far as the fellowship, there's like lots of observation opportunities. So some things I've observed are there's 3 different trauma groups on the adult side that I've observed. And like you can observe the peri group and that kind of thing. So if you're interested but don't want to fully jump into something, you do have the opportunity to observe things.
Lauren.
Good afternoon, everyone. I'm Lauren Morgan. I am a first-year fellow on the adult side. I did my internship also on the adult side at Michigan Medicine. I was on the MPAC team, and this year for the fellowship on the perinatal team. What team I'm doing next, I'm unsure about. So I'm not sure about next steps either. And I also co-lead a CVT group for depression with Janelis, who's a social worker in the adult side. And then I did the mentorships, DBT. I'm currently doing IVT. I'm doing CBT for depression right now, and I did CPP for the first 6 months. I think that's all I had to say.
Thanks, Lauren. Janelis.
Hi, everyone. I'm Janelis Turner. I am a first-year fellow here. I'm on the adolescent and child side anxiety team. I did DBT, CBT. Oh, I'm actually currently doing DBT clinic right now on internship. I'm also doing the trauma-focused CBT right now. For the last 6 months, I was in the CBT for anxiety for adolescents and children, as well as family-focused therapy, IPT for adolescents and children. I don't know exactly what I want to go into next year just yet. Probably Perry, probably CPP. I guess I'll see what interests me in a bit. But my internship was actually at Adventure Leadership, which was a program under the Department of Rec Sports. Yeah, Rec Sports at U of M. I did a lot of eco and adventure-based therapy. So I was like kind of also under my supervisor's own private practice. Yeah, and I kind of use a lot of those things here as well. Has been fun, but it's a lot about getting creative. So yeah. Oh, and she, her pronouns. It's nice to meet you all.
Jordan.
Hi, I'm Jordan. I use she, her pronouns. I'm a first-year post-grad fellow. Congratulations on making it to your last semester. Wow, that's so exciting. I did my internship at the DBT Institute of Michigan. In the fellowship, I've been on the depression team and the crisis support clinic, which is a 4-hour clinic that runs on Friday mornings. It's a bridge clinic between a crisis and helping people establish with like longer term care, so that, you know, it accounts for the gap in care that can happen after an unexpected sort of entry into needing mental health care, which is really neat. I've done CBT for depression and IPT, and I'm currently doing the CBT for anxiety mentorship. And then instead of a second mentorship, I'm doing research assistant work for a psychologist who does research at Michigan Medicine, Hans Schroeder, which is really cool. Next year I'm thinking, I know I've got some stuff up in the air, so we'll see in terms of what team, maybe prep, maybe anxiety, not sure. I'm also on the DBT consult team, and I co-facilitate one of our DBT skills groups. And I think that's it, right?
Thanks, Jordan. Yes, Bethany.
Hi, everyone. I'm Bethany. I use she, her pronouns. Thanks for coming. I did my internship here in Michigan Medicine, Child and Adolescent Psychiatry. I'm currently a second-year fellow, so I'll be kind of rounding out the fellowship this year. Currently, I'm splitting my time on the child anxiety team and child depression team. Love doing that. And as far as the mentorships I've taken, I feel like it might be easier to list the ones I haven't yet, but I've done the child CBT clinic. I did family focused therapy. I've done parent management training, which is focused on kind of management for children with ADHD. I've done the DBT for adult mentorship. I also did see the child parent psychotherapy didactics, but haven't taken a case with that. I'm co-facilitating the DBT multifamily group with one of the social workers on staff here. I've also helped to run a child anxiety and parent group earlier this spring, and then just a parent-based group in the summer for children that have anxiety or OCD. And right now I'm also taking motivational interviewing mentorship, also taking CBT for insomnia as well. So kind of just a whole bunch of stuff, which is great. As far as next steps, there's a possibility I might stay on as staff next year. So hopefully, but if not, I plan to still focus on anxiety, OCD work, but I do really want to stay here. But so I might see you.
Thanks, Bethany. Kristen?
Hello, everyone. My name is Kristen. I use she, her pronouns. I did my internship at Michigan Medicine as well. So I was on the child and adolescent side doing outpatient work. So I currently am on the anxiety team. I do a lot of work with teens and adolescents that experience social anxiety and generalized anxiety. I'm also interested in childhood trauma and have been able to get more training in that through the child parent psychotherapy clinic or group. And I've also started doing perinatal work. Love that, working with new moms. It's been a lot of fun. So I'm really interested in trauma-focused work and relational work. So some mentorships that I've done, I did the DBT, CBT, CPP, which are all of the acronyms that I sent in the group chat a little bit ago. And I'm now doing rotation with IECC, which is the Infant Early Childhood Clinic, where we do screenings for kiddos. I can't remember the exact age range, but I think like up to 5.
0 to 5.
0 to 5. Thank you, Melissa. And I co-facilitate a perinatal DBT group with Brook. We go over DBT skills with relational elements, and that's been a lot of fun. Next steps for me, I will be here for another year, so you might get to hang out, and that would be a lot of fun. And I think that's everything. Yes.
Thanks, Kristen. So let me also just talk about this process. So the application deadline is at the end of this month, on the 29th, if I'm remembering correctly. I should look at that. And I'm just confirming that. Yes, the 29th. So essentially before the clock strikes midnight that night, you would need to put in the application through our online process. The online process is actually relatively new, and I tried to change it a couple months back and couldn't because somebody had already applied. So I'll have to remember to essentially change it like immediately after you all apply. Because what's not there, what I want to include there is essentially a spot to designate different areas. So I believe it only asks if you're interested in child or adult. It doesn't specify other areas. So please put in, like, if you're interested in a specific area into the cover letter, what area you are interested in. So the deadline is the 29th. We typically do interviews in October and early November. And then my hope is to always get back to candidates, before December. So usually it's like close to around Thanksgiving time when I'm getting back to folks. But hopefully it's always, I've always been able to do it before December. Each year is a little different, so it's hard to say like this is what always happens, but applicants have ranged over the years between around 20 and 80 applicants per year, and so each year it's in between those numbers. And we also have different number of spots each year because it's highly dependent on who's leaving, who's in their second year, and what spots are open, and did I get approval for an extra spot, and multiple different things. And some of those things actually change between now and when I'm selecting fellows. So I think I have a range on the webpage to say 3 to 4. And some of that is, again, because some of those things change like at last minute. So for example, if a first year didn't go on to their second year, we would fill their spot. So historically, we've had 9 spots in the fellowship. And again, I am asking for a 10th spot this year. That would be CGSP. And so we'll see if we get that. The training year starts January 1. Now, you wouldn't actually start on January 1 because that's a holiday. And each year I essentially contact the folks that are starting and say, here is your start date. And it often lines up, depending on the week, with also our social work intern orientation that we have within the Department of Psychiatry. Because I do the orientation for the interns and the postgrad fellows on the same day. And so, I would keep you posted in terms of the actual start date. It's usually around like the 4th, around the 4th, I would say average in terms of the actual start date. And I haven't even looked at the calendar to know when that would be this year, but I certainly will know that as we get closer. And then my goal has always been in the director role is to essentially help the folks in the fellowship tailor the fellowship to what they want. So we have multiple mentorship opportunities and psychotherapy clinics. Each fellow has the opportunity to essentially do all of them. Not everybody does all of them, but there is the opportunity to do all of them. And then the goal is really to make it so that it's specific to what you want to get out of a 2-year experience in terms of whether that's the population that you want to treat or the kinds of therapies you want to be trained in. And we have lots of different options, as you can tell by the array of things that our current fellows have done. I'm trying to think of other like general questions that usually come up. Other fellows, what am I forgetting in terms of the broader picture?
With it being a stipend, you are able to defer your student loan payments during the time that you're in the fellowship. That's an important thing to mention.
Yes. Thank you, Jordan.
Mm-hmm.
If you're selected to interview, you will make a case presentation, but that information as to like that you have one and how long it's expected to be will be included in your invite to the interview. But sometimes good to start thinking about that because you'll likely need to do it with any job interview.
Yeah, so there will be a clinical case presentation as a part of the interview. The interview is actually a group of people interviewing you. So I am in the midst of, getting those scheduled. And essentially it'll be staff within our clinic and the current postgrads interviewing, the one candidate at a time. And we only have so many interview spots. So each year there are candidates that apply that don't get interview spots. So be aware of that as well.
I think another important thing is that if you are offered the job, there is like quite a few things that you have to do that at the end of your semester, which can feel a little overwhelming, including a drug test that you have to go get done at a specific location. So just an FYI. And then I think another important part is the first couple months of the internship or the fellowship while you're waiting for your licensure to come through, because that takes a while. There's a lot of trainings and then there's a ton of downtime, like lots of I have nothing to do, so what do I do? So just a heads up that those first few months it really starts slow and is not like an immediate jump in to seeing 20 cases a week. That's not what's happening.
unless you're, and I will say one caveat, unless you're a current intern and go into the fellowship, because typically interns that then turn into fellows can continue to see the patients that they were seeing as an intern, but being supervised by the field instructor still. So that is one difference that we have for folks that were interns in our area and then go on to do a fellowship as well.
I guess
So
another
oh, go ahead, Ella.
another one is that like it's pretty flexible, work from home or work in the office. A lot of folks work like 50-50 or some version of that. And I don't know that that will change for next year. Maybe Melissa can speak more to that, but there is quite a lot of flexibility with like what your needs or wants are around that.
Yeah, we recommend 2 days, at least in the office. And then some fellows are there every day. And some fellows are there 2 days and 3 days at home. And then we do have core. So in terms of like, what does the fellows' typical schedule look like? Typically it's we have core each week, which is at a specific time, which is a meeting with me, and then also some didactics every other week within that time frame. And so all the fellows are meeting together, and that is in person. And then most fellows are doing 1 new patient psychiatric evaluation per week. They're doing return visits, and the expectation is to have 22 to 25 return visit slots on your grid. And during the fellowship, you're kind of building up to filling all of those slots, and then taking at least 1 to 2 mentorships per 6-month rotation. And I think it's helpful, at least for some folks here, to know that psychiatry mentorships are completely separate from the social work mentorships that you would be doing here at Michigan Medicine if you're a current social work intern at Michigan Medicine. So they're mentorships that are with folks in psychiatry and are multidisciplinary. So you would be with residents, postdocs, psychology postdocs, and social work fellows. And then, obviously you would have indirect time to do notes and other things. Let me just check the chat here. What questions do you all have?
Melissa,
I
I do
had a-
see the one. Oh, I'm so sorry. I was just going to say, I see the one that was in the chat that said a list of the different clinics and teams in the Department of Psychiatry. And I think you might be the best one to answer what's all of those.
Yeah, so I can try to list them from memory, and I'm guessing I will miss some. So any fellow, feel free to chime in as I'm kind of thinking of the grid in my head. So we have the anxiety clinic. We have depression. And there's clinics and teams and things. So they're somewhat interchangeable. So we have the anxiety team / clinic. We have a depression team. We have a bipolar team. We have a PrEP team. We have perinatal team, crisis support clinic team. We have MPACT, which is essentially folks that are seen by a primary care physician in Michigan Medicine and need short-term kind of medication adjustments. We have a sleep clinic. We have Jerry psychiatry, although it's been unusual for fellows to cross either of those clinics. I said PrEP. PrEP is early psychosis clinic. And I think I got all of the ones in the adult. In child, we have IECC, which is Early and Infant Childhood Clinic. We have an ADHD clinic. We have a trauma and grief clinic. We have a depression team clinic. We have a general team clinic, essentially like it's where the kiddos go if they don't fit another box. And we have an anxiety team. And those are the main teams within the clinic. And then in addiction treatment services, we have an adolescent program and an adult program, and HPRP, which is Health Recovery Professionals Program. And then we also have intensive outpatient program. And then CGSP is its own program. It lives, at the Rachel Upjohn building, meaning like it's that's where it sits in the building, but technically is not directly in the Department of Psychiatry. And then somebody had a question, I think, that was talking at the same time as Ella.
Yeah, that was me. I have a handful of questions, so I was typing some of them in the chat. But one that I had was really regarding pay. My understanding is that it's pretty set. So with that in mind, what are your guys' experience or advice as far as what the cost of living is in Ann Arbor, and how do you balance that, or any pointers for that too?
I'll be honest, I get by because I live in a dual income household. And it is what it is. I live with my husband, he has a job. I have health insurance through the fellowship, and but we don't have dental or vision. I have dental and vision through his employer. And so frankly, like when it comes to budgeting, and I've lived in Ann Arbor for a long time, there are things that I do because we do have a budget, but I think like for those of us who have either a partner or the capacity to live within driving distance with a family member or something like that, it makes it considerably more accessible because Ann Arbor is quite expensive.
Yeah, as a single income household, I used to live in Ann Arbor, but I had roommates. And then I last year moved to my own single bedroom apartment, but I moved out of Ann Arbor. So now I'm in Ypsi because it's just significantly cheaper to live there. But yeah, it's still, to be honest, it's not great, but it's also not the worst. It's just, I am very mindful about how much I spend in budgeting and like what that costs. So it's, yeah, varies, I think, depending on the person.
And I will say, from what I understand, sorry, Jordan, I saw you unmuted.
That's okay.
So, okay.
Go for it.
We're paid, I believe, for 75% of, because 25% is considered like training, and still being, we are trained. We're given amazing training, but 75% is the clinic work or clinical work that we are paid for. And I do still want to echo though, that it's not the easiest thing. It's something to be very mindful of. And if finances is like a major piece to whether or not you're going to apply, I think it's something to be really mindful of, because it's tough. And I think, yeah, I mean, it's tough at times.
Oh gosh, Jordan, you were going to say
Yeah.
something. You go first.
No, I'm pretty sure I'm just echoing everyone else, which is like, I'm also like similar to Bethany, living on my own and live in Ypsi, and that does help. So being mindful of like cost of living in Ann Arbor, I'm not sure it's like super realistic with the stipend, but I guess like if my actual advice is like, if you're gonna do it, just being willing and able to hold on to the mindset of it's temporary, and like I wouldn't say it's ridiculous. Like I've considered getting a weekend job, to make it a little bit easier, but really holding on to the fact that like this is a 2-year thing, and like Kristen said, like 25% of our time is meant for education and training, and trying to factor that in as part of the pay. I don't know. So like mindset work, I guess.
Yeah, I was gonna say I actually do have technically a second job on the weekends, kind of actually with my internship, but it was grateful and it was a blessing to have it very much be like they allow me to be very flexible about it. But it does help to have extra money come in. However, I will say it can cause more stress and more overwhelming feelings. So again, balancing it out, what you can do, because this position is going to take a lot out of you, but it also can bring a lot of really good knowledge, really good like preparing yourself for onwards after the fellowship. That's why I'm still here and still, working through it all, because I do think it is worth it.
And I want to echo that of where I was leaving grad school. I felt like I had quite a lot of book knowledge and understanding of how different things worked, but I don't feel like I had the actual application. And being able to have this training opportunity, and I mean, I'm blessed with my supervisors, they're amazing, and there are so many opportunities of being able to learn. The major downfall of the fellowship is definitely what we get paid, and that's just tough. And also I don't feel like I would be as prepared to enter the workforce without having had, and I mean, I've only been here 9 months, and anticipate being able to learn a lot more in my next year. So it's a lot to take in mind, but it makes me feel much more prepared as a clinician to move into not having a supervisor one day and kind of having a lot more responsibility for my own practice.
I think one upside too with the fellowship is that you don't pay for supervision, and depending on where you get a job after your fellowship or like your internship finishing grad school and everything, some employers don't provide supervision, and so you have to pay for that in addition to whatever you're being compensated. And at least for us, we get about, what is that, like 3 hours a week or something with core and our individual. We get 2 individual supervisors. Plus, if you're in clinics, then you can get supervision there. So you just get a lot of support and supervision, which makes it pretty nice too.
I just want to respond, Amanda, to your question. I remember, so I kind of changed to interpersonal practice my last semester of the MSW program. So I didn't have a lot of training, and I was like, I really want training. When I was looking at peers of mine posting on Psychology Today or creating those summaries and saying, this is what my expertise in, I was like, your expertise? What expertise? Like, I don't have any, I really felt like I didn't have anything I could put on a like kind of clinical profile. This job provides you with so many things you could put on a clinical profile, like, and really feel like you truly have that training, resources, people to go to advise you on those specific things when a question does come up. Like, and then I also think the fellowship outgoing, when you have that on your resume that you did a fellowship and got further clinical training, I think the power that has in clinical settings is pretty significant, because we don't get clinical licensure necessarily in the state of Michigan. I think it depends on where you are, but having that, I think patients see, oh, they have clinical training beyond just an MSW, which some patients might not care about, but I do think is significant when you're looking at licensure in other states where you may have a clinical licensure kind of on your, what is it called? Your, I don't know, certifications list. So that's a big part of why I came. I hope that helps.
I think too, working in this or being in this fellowship, the clinical training is so much, but there's also an exposure to how a large health system functions that I think has been really educational. And I've been thinking about it, like I really like after working in such a large health system, the transition into like a private practice or a smaller group practice is a lot easier than like kind of scaling up, like how much we learn about protocol and the different resources we have, and being able to like ask questions. One thing that I think a lot of people or a lot of the fellows will talk about often is how grateful we are for having legal consult and our supervisors to ask certain questions to, and then being able to sit in on like department meetings. Like if there's an educational aspect to this outside of clinical, which is just like understanding the health system a little bit better. Like I know a lot more about insurance now than I think I would have been able to learn as quickly at like a group practice or a private practice, which was something that I didn't expect to really like become literate in.
Yeah, kind of want
I
to.
was just gonna go back. Oh, sorry, Al, go ahead.
No, go ahead. I'll go after.
I was just gonna go back to George's question related to the group therapy and the RVs. So, or return visits. So it does count as in total in terms of what the expectation is. And we are an RVU based model in terms of like credit, clinical credit. And so I can't remember if it was Brooke, I think said it was wonky. It actually comes down to like, is it a group with a very low participants? Because if it is, then it doesn't count for very much. And if it's high participants, many participants, then actually it's like getting more credit. So it really comes down to how many folks are in your group in terms of how much credit you get.
Okay, thank you for clarifying.
But it is included in terms of the 22 to 25 for sure.
Yeah, I just wanted to kind of piggyback off of what Jordan and other folks are saying about some of the benefits of being at the RUB. Yes, the money is not going to be that great, but as you know, Bethany pointed out, you are kind of investing in yourself and you are gaining a ton of experience that you pretty much are not going to get anywhere else. Like you can think about like the acuity range that come to the clinic. If you go to like a community, you know, clinic or some kind of group practice, they have a lot of, you know, kind of limitations. Like if you're, you know, a certain sort of substance user, if you have psychosis, you know, if there's like severe, you know, mania, you know, there's all sorts of kind of things that clinics just don't do. And you're not going to see those people. You can see folks like that here and you'll get that experience. And most of our patients are also, you know, taking psychotropics. So you end up learning a lot about, you know, like medications, and you get to, you know, collaborate with their prescriber. And, you know, like assessment skills, you know, you get to conduct like evaluations and then diagnose people, you know, and determine whether, you know, they meet criteria for bipolar or for psychosis or, you know, severe suicidality. You know, you get to make calls about whether or not it's time to talk about higher levels of care, or you get to meet people who were at a higher level of care that are now, you know, ready to go back to an outpatient level. And you don't get to do those kinds of things in the community very often. And even if you don't want to do that forever, it's super awesome to be able to have a couple of years of experience doing that. You know, I mean, I kind of want to go back and, you know, like, I think I want to go into the community after this, but I feel so good because like, I feel so much better about, you know, like receiving patients who were at higher levels and, you know, connecting patients with higher levels if they need it, and also diagnosing them.
Yeah, I wanted to follow up too about, you know, what are other options out there for folks? So, you know, in general, I would say the options for new graduates is actually much more now than it was back even 5, you know, especially 10 years ago, because more group practices take limited licensed clinicians, more than they did. Not all group practices take limited licensed clinicians, and many other areas also don't take limited license clinicians, primarily because it's a billing issue. So, you know, outside of a group practice that has a designation as a group practice, limited license clinicians just can't bill. And so you're looking at either private pay, in treating private pay, or doing more case management work. So like at CMH, typically, you know, if they're hiring a limited license clinician, you're doing more case management work than you are doing psychotherapy. And then back to what Alec was saying, in a group practice, you're just not going to get the variety of patients that you do here at Michigan Medicine, both because we see such a variety in the acuity and the psychosocial needs that folks have that come here and we take their insurance. And then also because we're a tertiary care center. So people come here from all over to get care. If we missed any other questions in the chat, please feel free to just shout them out. Or if you have other questions.
I think a while ago, Nat had asked if it's worthwhile to apply to the
GSP?
Yeah, the fellowship if it's not yet approved.
I think it's worthwhile. I mean, obviously, I would let people know. I think the other piece too is, so that position will also cross outside of CGSP. So some of the time will be in CGSP and some of it will be outside of CGSP. So folks that want, are interested in that, keep in mind that, you know, I guess if you're only interested in CGSP, then, and you don't want to work outside of that in any way, then, you know, feel free to reach out to me directly. My email is on the website and we can talk through that. But, you know, there will be some overlap in terms of other patients that you will see.
Just thinking quickly about Kayla's question again, something that I did that I would really recommend was I met one-on-one with a couple of professors who I felt really, or instructors that I felt like really inspired by, and asked them about their career path and what they think about the field right now, and what they might recommend. And I think, you know, if there was anyone that you felt really inspired by, or you felt like you would want to emulate, like it was something that I'm eternally grateful I did.
I think this has been said, but I just want to echo it, which is that I really have appreciated the opportunity to explore in this fellowship and the ability to be candid about what that looks like and the things that I'm confused about with my supervisors and how they have led me to exploring different places, different like clinics and that kind of thing. So I just have always felt very comfortable and safe communicating when I've been like, ugh, this is hard. I don't know if I like this. How do I make this better? And have always gotten incredibly useful and supportive information out of my supervisors. And Melissa is one of those people that's definitely done that. So just the flexibility and the opportunity for growth, even if you don't quite see it right away, is really worthwhile.
And I want to add to that as a younger person. So like I just turned 24. And going into this field, it felt really difficult, especially working with people that are much older than me and trying to like talk to parents. And I now work with adults, which I never thought I would do before. And having the opportunity and the support and people that will like push me appropriately and being like, you can do this and you can try this. And it was really, really huge. So that was another piece of like to what Ella was saying, where we get to try new things and have a lot of support in the trying of the new things.
And then to add to that, like the fellowship is like a really nice thing to do during that awkward LL period where, you know, like Melissa's saying, you might have a hard time, you know, getting hired, or you won't get a decent fee split, or you have to do private pay or do case management during these 2 years. You get to just like go like full-blown clinical and get all the supervision that you need. I mean, I actually have 3 supervisors, and I've had that both years. So I have 3 hours a week, which you don't need, and it's another story. But just to make the point that, you know, people are going to sign off on whatever you need at the end of the fellowship, and like there's time at the end to prep for the licensing exam, and then like you're good to go, you know. So it's a really cool way. Like if you want to be cut and dry clinical and you know that you want to, you know, be a psychotherapist, like, I mean, there, you know, if you go on the internet, there aren't really many programs like this in the US, unfortunately. So it's just super awesome. So that's like the investment side of it, you know, and at least that's what I'm banking on. So.
Yeah, I will say this lastly, because I know we're running out of time. So I did do a follow-up, so, you know, study of like what happens to fellows after they graduate. And many of them worked in health systems, many of them worked in private practice, and then a handful of them went back to get a PhD. You know, I think the pieces that everybody said in terms of that follow-up was just how kind of surprised they were that when they went, you know, after the fellowship, they could essentially get any job that they wanted because they have training that you can't get anywhere else. And I think, you know, that's at the end of the day, what is beneficial about the fellowship is if you want continued training, then getting a fellowship is the way to go. So thank you again, everybody, for joining us today. And again, my email is on our webpage, and you can feel free to reach out to me directly if you have any questions. Hopefully I'll see your applications in the portal. Take care. Bye-bye.
Thank you.